Joe D'Angelo. I work with Partners in Rehab Physical Therapy. We've been in the North Shore, Merrimack Valley area for over 21 years now. We started our first clinic in our facility down in Saugus and Route 1 North in 1996. We began doing home care, home care, occupational therapy, physical therapy, and speech therapy. We then moved on to outpatient care. Opened up our facility there, like I said, in 1996 in Saugus. Started doing basically just exercise-based physical therapy, treating all orthopedic disorders, wrists, ankles, hips, knee replacements, low back pain. Our specialty that we work with is with the New England Baptist Hospital. We work with their low back program, their spine back boot camp, we call it. So with their orthopedic doctors, they would go through their spine program, and we'd work hand in hand with their doctors to come up with the program to make sure it's individualized to your treatments, to your needs, to your aches and pains, however your pain tolerance may be, your range of motion, what your flexibility is like, your strengths, your weaknesses. And the back program is great. We've been doing this since we started. And I figure about 80% of Americans deal with low back issues, low back pain. I myself have gone through it twice. It's been great for me. Being a taller gentleman myself, I carry a lot of weight on my hips, on my shoulders, on my back. So there's things that we do there that help you to go through your everyday routines that makes it easier on you. Excuse me. The main purpose of the physical therapy is to basically keep you active, keep you from stiffening up, keep you loose. The stretching is going to help with your range of motion, with your flexibility and your strengths. A lot of what we do is based on light resistance, your own weight, and getting back to normal strength. What we do is you would come in, a typical appointment, you would come in, you schedule an evaluation with one of our doctors or one of our physical therapists. We take appointments. Normal evaluation takes about an hour. We can get you in within 24 hours. We take all insurances, Medicare, Blue Cross, Blue Shield, Tufts, Fallon, Aetna, all of the Mass Health products. So we would normally have you call, set up an appointment, or you can schedule with us online, partnersinrehab.com. You can register there for the care, whether it be a motor vehicle accident, a workman's comp claim injury, or just a personal injury. We can help you in all three situations. What we would do is you schedule the evaluation. When you come in to meet with our physical therapist, they would take you in to our evaluation room and go over what the doctor's diagnosis was. We work hand in hand with the doctors or whoever it is you may have seen before that referred you to us. Sometimes we'll have home care physical therapists help you transition from coming to the home into outpatient facility to continue your physical therapy treatment there, to make you get ready for dealing with outside activities rather than just being in the home. So what you do during that evaluation with those doctor's notes, we'd come up with a plan to have you come back. Normally you come back 2 to 3 times a week, roughly each time you come back for about 40-45 minutes and go through an exercise program that the PT and the doctor came up for you. Depending on your injury, whether it be shoulders, back, knees, they would take some measurements to see where you were at when you come in during the middle of your plan, roughly about, depending on how long you went for, let's say it was 6 weeks, about 3 weeks in, we take some more measurements to see how far you're progressing, let the doctor know, see where they would want you to continue on from that. At the end of your discharge, we take the same measurements, let you know how far you've progressed, and then from that point on, we can give you some home exercises. What we do with the home exercises is basically different stretches, light exercises that you can do at home, or if you have a gym membership where you can go to a local gym or a YMCA, or even like a senior center like this, if they had a small exercise room with some different equipment, you could go in and continue your stretches there. So when I try to see if I can get this going, I'm not sure if she's gonna. But it's just a small presentation just to give you some better idea of what exactly we treat, different conditions that our PTs would see, information about our clinics, where we're located. Currently here, closest would be over in Georgetown on 133. If you guys are familiar with where Dunkin' Donuts is in Georgetown Center, just off the center of town, we're in that plaza there. And also over in Methuen on Route 110 as you're going towards the Pleasant Valley area where the Loop is, the shopping center there. We're in the Scott Construction Building. We've been there for about 13 years now. Opened them about 8 months apart from Georgetown when we began opening up in this area. So we get this going, I guess, in a second. And we'll
So,
see what's
just
going
a
on. Thank you for your help. I
startup,
appreciate that.
no
Yeah,
problem. Like, oh my gosh, we've never used a soft top.
Right. I guess I must have some older technology that'll work on
I know,
a
right?
different laptop than what I
Yeah,
have here.
smart.
So yes, have any of you guys gone for physical therapy in the past?
Mm-hmm.
You have. Has it been beneficial for you?
Oh, yeah.
Yeah. Very nice. Do you mind if I ask what you've gone for?
Well, both knees, I had replacement in the shoulder,
Yep.
so I went to rehab
Okay. Yeah.
and, in Burlington at the
Yeah.
time.
Okay.
But now they opened one in, Danvers
Yeah.
there.
A little closer to home.
Yeah.
Easy ride. Yeah, yeah, absolutely. Yeah, it's great. You know, we've noticed a lot of doctors are starting to refer physical therapy rather than going in for surgery, rather than having you go on for medication, pain medication to relieve any aches and pains. You know, pain may hurt, but pain necessarily isn't a bad thing. Pain can be, you know, showing you that your body's healing, showing you that your body's reacting to what's going on in your system. You know, it's letting you know that you need to do something to combat that pain. And just masking it with pain medication isn't going to be beneficial for you. You know, it's not going to get the blood flowing back to those muscles to have it heal properly. With the, you know, medication, it's going to allow you to continue your everyday lives and without pain, but you can be further damaging yourself by, you know, just going for a walk or taking a jog or going up and down stairs. There may be something in there that's not healing properly, but the pain is being masked by the medication to allow you to continue on with your daily activities. What we want to do is have you come in and come up with a plan that, you know, we can work with what you may be doing in your daily life. You know, if you have a job or if you have a certain routine that has you being active all day, we want to make sure that you can go along with your normal life and not feel these aches and pains and not further any injury as well. So, Ms. Laura, there you go.
Take a few to load, yeah, it's just a little, you can just X that one out, that page.
All right, better late than never, right? Speak too soon.
Up there, that's.
Full screen. I guess I did speak too soon. Oh, it's in full screen right here.
Yeah.
Okay, well, that's perfect, I guess. All right. So, all right. Well, if you guys can see this here, we are Partners in Rehab Physical Therapy. Like I said, we've been helping patients over 21 years now, heal better, move better, and feel better. We've got 3 convenient locations, like I said, in the North Shore, Merrimack Valley area. We're currently in Georgetown on Route 133, Methuen over on Route 110, and Saugus on Route 1 North near the Fuddruckers Plaza. If you're familiar, going up by Kowloon, around that area. These are the information on 3 locations. You can get an idea of kind of who we're working with. Our 3 clinic supervisors, being Kristen, Casey, and Mike. Mike's our clinic supervisor here in Georgetown. He's been with us for over 9 years now. Great guy. Went to Northeastern University, graduated with his doctorate of physical therapy there. A lot of people now are wondering why they've changed it to a doctorate program with physical therapists. In the past, there was some confusion with the PT could come in and do the same treatments being a personal trainer rather than a physical therapist. So we want to make sure that if you are going to see a PT, that you are seeing someone that has been trained properly, has the 7 years of experience, the licensing, credentialing to make sure that they treat you properly, and that you're getting the care that you need, quality care, from a physical therapist. Our team here, we have roughly about 28 employees. Like I said, we've been in business for over 21 years, and a lot of our employees have stayed with us for a long time. We've had employees that have been with us for 14, 15 years now, which is a testament to our company. You know, our core values are to make sure that we're treating patients in a clean, comfortable environment, answering any questions they have, and giving them the care that we would want to receive ourselves. When you're going through physical therapy treatment necessarily, you may be coming from an incident or an accident or injury that could be very traumatizing. And when you're coming to heal, we want to make sure that you're comfortable and that you feel safe and that, you know, you're on your way to back to getting back to your routine and healing properly. So you see our team here. This was our 20th anniversary that we had. We celebrated about a year and a half ago. Most of our employees come from this area. They work in the towns that our clinics are in, so you know they know where you're coming from. We've seen in our clinics that we have generations of families that have been coming with us for years. People that have had their grandchildren, mother, father, grandfather have come in over time because they've gotten great care from us, so they want to continue coming rather than trying someone new. Practice overview. At Partners in Rehab, our expertise, like I said, is in the treatment of orthopedic disorders. We treat, you know, such as back, neck, shoulder, elbows, wrist conditions, any hip, knee, and ankle pathologies, and countless other conditions affecting an individual's ability to move freely without pain. Partners in Rehab, we strive to raise the quality of your life, and we enable you to participate more fully in your daily activities. Our PTs will understand how your body works and know the best way to keep you moving. Our PTs, they're dedicated to serving the families of the North Shore communities, and our patients are of all ages, are being treated in a comfortable, technologically advanced facility that promotes patient confidence. Here you'll receive motivation, ongoing support, and clinical expertise from the best team of PTs in New England. I can say for myself, like I said, I've been through our PT program for our back twice, and being a large gentleman myself, it's good to know that, you know, the care is right there in town where I need it. That I don't have to continue to go back into town to see my doctor or, you know, pay a lot of money for a specialist. You know, knowing that what my body can handle, just a little bit of pain, going in there and just having a little bit of PT and exercise-based therapy to help me out, stretching, getting my range of motion back has helped out greatly. You know, and it's a lot less cost effective than going under for surgery or like I said, any other options that may be out there. So what is physical therapy? Physical therapy, like I said, is mostly an exercise-based therapy, using your own body and light weight and resistance to gain back your range of motion and your strength and all your mobility. Physical therapy is a dynamic process which works to restore, maintain, and promote optimal function, wellness, and quality of life as it relates to movement and health. Attending PT is a smart way to both maintain and restore good health. At Partners in Rehab, we aim to make physical therapy as accessible and convenient as possible to ensure your best recovery. Right there you'll see, this is our clinic location down in Saugus. We have a lot of great equipment that works out for a lot of different things. You know, we have our bike here that keeps it going for the shoulders, you know, to keep your range of motion on your shoulders. We have a step equipment here for going up and down with balance issues, hips, knee, back problems. We have tons of tables here that are spaced out. This is a panoramic view, so it gives you kind of a vast look over our entire Saugus clinics. But, you know, a lot of different lightweights, resistance that we use. So just, you know, 5 pounds max sometimes when you're going in there, and using a lot of your own weight as well. Resistance bands that add just a little bit of tension, almost as if you were like in water aerobics. We have that light kind of resistance just to give you enough to kind of build up your strength. Treatment options that we offer, postural analysis, basically telling you how you may be. If you remember back in elementary school doing the scoliosis test, you know, we would go in there with our measurement tools to make sure to see what your posture is, try to get you back up going well. Hydrotherapy, whirlpool programs that we would offer to get the blood flow going back into you know, your joints. Home programs, like I said, we offer exercise programs that we would send you on after you came through therapy and you completed your program. We would give you some options to go home with to help you continue stretching and going with your exercises. Exercise instruction at the clinic, explaining why these exercises are beneficial to you and why the proper way to use them and the proper techniques to go about going through these exercises. Soft tissue mobilization, muscle energy and joint mobilization, iontophoresis, ultrasound, thermotherapy, cryotherapy, and the eStim TENS unit. Those are all different electronic-based equipment that would help the blood flow. If you guys have ever had that before, where it's a TENS machine, you have the pads, the electric stimulation pads that go on there that you can put on opposite sides to generate blood flow to that area. So after you do a small exercise program for a couple minutes, this will continue to let the blood continue flowing to that area to help it heal properly without exerting as much energy or using so much on those muscles and joints that you're not further injuring or putting more strain on those muscles, but allowing it to heal faster at the same time. So, did you know physical therapy is an effective medical treatment for aches and pains caused by an active lifestyle, work, travel, pre- or post-operative healing, and for disabilities caused by disease, injury, or developmental disorders? PT is an effective means to avoid these everyday aches and pains, injury, and in some cases even surgery. Our physical therapists excel in developing a personal treatment plan that will address your lifestyle, activity level, and areas of functional weakness in order to improve your physical fitness level and increase your mobility. Like I said, we will do this during your initial evaluation and come in here based on what your injury or conditions may be. You would work with the PT and your doctor to come up with an individualized program that isn't going to overexert your issues or your injury. We're going to slowly take you through the process of getting your mobility and range of motion back and back to your everyday lifestyle. The Partners in Rehab PT Spine Program, like I said, we work coincide with the New England Baptist Hospital. Our PTs are all trained in their spine program. We meet with them roughly once a year. We go through a symposium with their orthopedic doctors. All of our PTs go there, physical therapist assistants as well, just to keep up to date with their technology, to keep up to date with their treatment programs, to know that we're treating their patients the way they want us to. We want to make sure that our communication with their doctors is constant. We want to know that you know, we're doing the best we can to offer their patients the best care as possible, not only with the New England Baptist Hospital, but with any doctors, local PCPs, any other orthopedic doctors that may be from different groups up in the area. We want to make sure that we keep that communication going because that's the best way to make sure that you're going to heal properly. One of the areas in which Partners in Rehab excels is in our treatment of the spine program, our boot camp. You work with our fully trained therapists to treat appropriate patients using functional-based therapeutic exercises consisting of flexibility, strength, aerobic, and endurance training. These intense and aggressive exercises are designed not only to increase deficits in flexibility, strength, and endurance, but also to normalize function and foster independence. So we want you to be able to leave with that program and feeling confident that you're going to be able to go out in your daily activities and not feel the strain or worry of having to re-injure yourself. We want you to be confident leaving us so that you're strong enough to go out there and continue your daily life, and not have any interruptions, or come back to see us. As much as we like to have patients, we don't want anyone re-injuring themselves and coming back to us with the same injury. We want to have you leaving there confident, healthy, and strong enough to continue your daily life again. The byproduct of this program is reduced symptoms. However, the main objective is returning patients back to their everyday lives and preparing patients for discharge with a fully individualized discharge program for your home or at the gym. And how can a physical therapist help? Our physical therapists are your partners throughout your journey in restoring and maintaining your motion so that you can function at your personal best. Our physical therapists can teach you how to use the following strategies to prevent back pain. Different ways to do that: you participate in regular strengthening and stretching exercises to keep your back, stomach, leg muscles strong and flexible. A lot of what comes out of back problems is dealing with your core, your hips, your thighs, your quad muscles, all connected right there in your core. And sometimes if any of those go, could affect into your lower back. And I know with me, when I've had lower back issues, it just grips you. There's nothing you can do. The spasms continue.
This program was listed as fall prevention.
Yeah.
Are you going to talk? I think most of us are here.
Yeah, as I explained
when
as I explained when I first came in, one of our physical therapists unfortunately couldn't be here today. So I had to kind of tweak the program a little bit just to go over what physical therapy could do for you and benefits of that. That's why I brought the self-balance test as well to have you take this home, continue about fall, so that way if you did have any questions further on, you can contact us at a later date. Unfortunately, like I said, one of our PTs that was scheduled to be here couldn't make it. So I didn't want to.
So we're not going to have anything on fall prevention?
No, there may be a little bit in this here in the program, but personally, I don't have anything on that. So I do apologize. Unfortunately, things came up, and the physical therapist couldn't come here today. But I didn't want to leave the program empty-handed and have a void in their schedule here. So I just wanted to come and explain, how physical therapy could still help you, even with fall prevention. What it's going to do for you is going to enable you to strengthen the muscles that will, keep you preventing from falling. Like I said, a lot with your core would develop with that there. But if you take the self-balance test home and answer any of the questions, I'd say if you answer yes to at least 3 of those, then you may want to give us a call and schedule an evaluation with the PT, so that way they can see which muscles and what body functions aren't working properly to help you from, any fall prevention. So different things as far as how PTs can help though. You want to keep your body in line. It's the most efficient way to help you move. Good posture, obviously, not slouching. You want to keep close with your body, doing any lifting, bending at your knees, making sure that you're not straining any other body parts. And maintaining good physical fitness regimen. Obviously, you want to stay every day doing some type of physical activity, like they say for kids. 60 minutes a day is always great to help you out, but it continues on later on in life. You always want to make sure that you're stretching, that you're pliable. Big thing right now, I don't know if you guys are football fans, but you see with Tom Brady, the TB12 methods, he's playing until he's 40s, and the reason why he's doing that is he stays hydrated. A lot of water, a lot of stretching, and good healthy diet as well will keep you mobile and strength, and your range of motion will be a lot better later on in life. And it kind of relates with physical therapy. We do a lot of that with the stretching and the light exercises, so that you can keep the body parts loose and maintain a good physical fitness level. Following areas are different disorders and health conditions that can be seen by a PT. If you're having arthritis, I can just read these off here. It's frozen on the screen here, but different treatments that a PT can help you out with: be arthritis, back pain, any balance issues, carpal tunnel syndrome, motor development and functional skills, chronic obstructive pulmonary disease, COPD, dislocations, fractures, hand injuries, headaches, osteoporosis, pelvic pains, any sport injuries, sport-related injuries, stroke-related injuries, traumatic brain events, musculoskeletal disorders, and your basic joint aches and pains. Different treatments that we offer that could be treated by a physical therapist. We do have our online and social media pages where we update our events that we're currently doing in the area, different races that we sponsor. We put up different newsletters as well, quarterly, where we'll have our PTs write an article that will share some information, different stretching techniques, ways to help you get through the seasons, to keep your mobility during that time, whether it be in the summer, out at the beach, or in the fall raking leaves, in the winter time, shoveling snow. Different tips that our PTs can give you to keep you from further injuring yourself during those seasons. At Partners of Rehab, like I said, we're located conveniently with our 3 locations in the North Shore. And if you did have any questions or anything, feel free to contact us at any time. You can visit us online at partnersofrehab.com, or you can call any of our clinics directly. And we have some brochures here, I think, that we've left in the senior center that you guys have taken with you as well today, that can answer different treatment options. So that's kind of in a nutshell it. I do apologize for not having the PT here with us today to answer any fall and balance issues. We're going to try to reschedule that though, so that we can have someone in here that can answer any technical questions for you and give you more direct advice on what we can do. Like I said though, if you do have any issues right now that are pertinent that you want to have answered, you can feel free to swing by our Georgetown office, or even just call over and you can speak to Mary Ann or Mike, the PTs over there that can help you out, and hopefully we can reschedule with them here someday soon. So does anyone have any questions at all relating to physical therapy?
Do you have to be referred to by a doctor?
No, not necessarily, no. So they've changed that where in order for us to treat you though, we do have to have a referral, but in order to set up an appointment to be seen, you do not. Before it used to be that way, because it would be a way for them to kind of refer you to whoever you wanted to be seen. But you have the option to be seen by whoever you like. It's your body, so you get the right decision to see who wants to treat you. But before, kind of like with pharmaceuticals, obviously doctors are persuaded by certain people to refer them to certain doctors. I know we've seen more recently some of the hospitals, the doctors would like to keep people in-house, whereas like you said, if you go with Leahy, rather than traveling back and forth all the time with that commute twice a week, the doctors can refer you to someone local, whether it be us or somebody else. That's easier and more convenient for you. But rather than having to go off the doctor's referral, you can do your own research, find a physical therapist or someone that you like and feel comfortable going to, set up the evaluation, get treated, and then receive the referral afterwards so that we can follow up with the program. Anybody else? Any questions or comments? Well, I thank you for your time today. I do appreciate you coming by here and listening to my spiel, and hopefully gave you some insight on what physical therapy can do for you. And if you guys did ever have any issues or questions, feel free, like I said, to call us at any time. And hopefully, like I said, we can reschedule the main event that we had here again.
Okay.
All right. Thank you
you.
guys. Appreciate it. Enjoy the rest of your afternoon. It's a beautiful day out there today.
Yeah.
Hopefully you get out and be active and